medical news tonight, it's Black Maternal Health Week, and studies show Black women are 5 times more likely to die from pregnancy-related causes than whites. And some doctors are joining the growing movement to raise awareness about the crisis. Joining me now is Dr. Sophia Lubin, an OBGYN from Symphony Medical here in the city. Dr. Lubin, thanks for being here.
Thank you so much, Cheryl, for having me. I'm so happy to be here, especially to talk about Black maternal health.
Yes, I know that's something you're very passionate about. And as you know, the Black maternal mortality rate is disgraceful, not just in this city, but this entire nation. How did we get here, doctor?
Well, a number of reasons. I think to start with, we have to think about just racism as a whole and how that affects all aspects of our lives. But the medical care, medical health systems are not, we don't take anything for granted. It's a part of the system in terms of racism, implicit bias, explicit bias. So that's just a part of the problem. There are also many gaps in medical training and how we're educating our medical providers in a way that, again, propagates the implicit bias and racism throughout the system.
Yeah, and the vast majority of pregnancy-related complications are preventable, correct?
Unfortunately, they are. Up to 80% can be preventable. And some of those reasons are things like maternal health, hemorrhage, things like preeclampsia, if they're not recognized early enough, is what propagates the bad outcomes that we suffer from. And so the problem is that unfortunately, Black women are often not heard, not seen. Their feelings, their symptoms are typically ignored or dismissed. And that's what leads to some of the preventable causes of Black maternal health.
Good point.
The mortality.
Absolutely.
Yeah.
And this, the state health department has several new initiatives to help women of color. They're creating a state doula directory and increasing funding to support perinatal centers. What more needs to be done in your view?
Well, in my view, I'm so excited that they do have all of these new initiatives. However, we need to understand that it's really the collaboration of the healthcare team that makes a difference. Understanding how to incorporate doulas in the medical and healthcare team is what's going to lead to better outcomes. Understanding that, throughout medical education, that the teaching and understanding of implicit bias, understanding our own attitudes towards our patients, especially our Black patients, is what's really going to help bridge that gap.
Yeah, and I have 30 seconds. Doctor, tell us how pregnant moms can be more proactive. What are some of the key questions they should ask their OBGYN?
Well, first of all, they should know how they can be in relationship. Remember, it's a patient-doctor relationship, and making sure that that relationship is not adversarial. That's one. Two, always having a support person with them and understanding that they have a voice. They have full agency over themselves, and to always ask questions. So that way they are clear on what their healthcare outcomes should be and what their healthcare needs are, and that their doctors are actually addressing them.
Excellent advice. Dr. Sophia Lubin of Symphony Medical, appreciate your time on this Friday night. Thank you.
Thank you so much for having me.